Good afternoon, everyone. I'm Demetrius Peterson, an attorney in Husch Blackwell's Education Group, and welcome to our Student Health and Safety webinar. Before we begin, I would like to cover a few housekeeping items. At the bottom of your audience console, there are multiple application icons for your use during the program today. If you have any questions during the webcast, please submit via the question box. We will try to answer all questions during the webcast today, but if a fuller answer is needed or we run out of time, it will be answered later via email. A PDF of the presentation is available in the Resources folder. This program has been approved for legal education hours. To report your hours, click on the CEU icon at the bottom of the screen. A certificate of the attendance, including course numbers, will be emailed to you tomorrow, along with a recording of the webcast for watching and sharing. Toward the end of the program, be sure to complete our short survey. We use your feedback to plan future programs that are applicable to your business needs. That is all for the housekeeping items. Let's get started with our program. Today we'll be discussing current health and safety issues and applicable legal considerations. Joining me this afternoon is Teresa Molyneux. Teresa is a litigator representing higher education institutions. Teresa also counsels education clients, conducts athletics and Title IX and historic misconduct investigations. And I have routinely assisted clients with compliance issues involving federal anti-discrimination laws, such as Section 504 and the Americans with Disabilities Act. And so let's look at some of the topics that we're going to discuss today. We're going to discuss COVID-19 risks on campus. We're going to discuss testing and contact tracing, mental health resources, and ADA considerations. I also want to note that we do have a few slides that will be at the back end of the program related to service and support animals. If we have time, we'll cover those today, but if not, they'll be included for your reference. Let's talk with COVID-19 risk on campus. This is the most pressing concern right now for higher education institutions. So what are some of the risks associated with COVID on campus? The CDC put out some guidance discussing some of the risks that are pending right now. Lowest risk, and it put them on a sliding scale. On the lowest risk, according to the CDC, are virtual classes. Of course, environments where we are working and studying off campus and also attending virtual or off-campus activities. Next on the scale would be what they classify as a more risk category. That would include small in-person classes, activities, and events. According to the CDC, as we know, and I believe these are things that are being implemented on most campuses, the CDC still encourages everyone to remain 6 feet apart whenever possible, to not share objects, and to utilize hybrid or staggered rotated scheduling whenever possible. And of course, the highest risk on this scale is just full-sized in-person classes, in-person activities, and in-person events. Those are going to create the highest amount of risk right now. And so what we are encouraging clients to do, according to the CDC, is to maximize social distancing practices whenever possible to minimize the risk. And this can be done by changing class schedules. So students students would attend courses in the same small groups, would also, whenever possible, not intermingle groups. In this approach, it would also include a staggered schedule or hybrid in-person and virtual classrooms, and also semester scheduling. I know that Syracuse University is currently utilizing an alternative in-person schedule for this fall term, where half of their students attend class in person one day, while the other half follow along virtually. This minimizes the amount of students that they have in the classroom and allows them to be able to keep students physically distant in the classroom and in the buildings by swapping spots on alternate days. I believe that Purdue, Notre Dame, and some other schools have also alternated their schedule, are also offering an alternative schedule. But in this case, I believe that they've changed the calendar to where they started earlier and they're going to end the semester before Thanksgiving break. So schools are using a variety of ways to try to accomplish some of these suggestions provided by the CDC. And so I just wanted to just go over that and just so that you know where other schools are falling in the landscape. So best practice. Consider, and this is more physically within your buildings, one thing that can be done is to consider designating one-day directions for hallways, for interior and exterior pathways, etc. And so this would limit the amount of people that are passing each other within a physical building. Also, along those lines, you can assign entry and exit doors to minimize the amount of students and staff and employees that are entering that are moving past each other as they enter and exit buildings. Another thing that's been done is to stagger student and faculty staff and arrival and departure times. So make alternative changes and have some of your classes start every 30 minutes instead of every hour, which would then minimize the amount of traffic coming in and out of buildings. And for employees, it would minimize everyone showing up at once and, entering the building at once, going to get coffee all at once, and it kind of spreads it out and allows employees and students to physically distance. And so when we're considering those best practices, you want to think about the morning rush. You want to think about the lunch rush. When are the most frequent times that bathrooms and facilities are used? And so by spreading that out, you can actually create distance within your building and distance amongst your employees and students. When it comes to housing, the CDC has released some information about housing as well. And so, of course, the lowest risk on their scale is when residence halls are closed. The next on the scale is the more risk category. And in that more risk category, residence halls are open, but at a lower capacity. Generally, what that means is that you would have the residence halls open for student living, but you would close common areas and areas that necessarily don't need to be open for students to reside in the halls. And then you have the high risk category, which would be the residence halls are open at full capacity. The common areas are open. And so the CDC recommends to limit dormitory capacity or offer other housing accommodations. And so I'll talk about that here in a few minutes. I'll get into students or employees that may be in a high risk category. But one thing that Duke University is doing is they're offering local hotel rooms for students who fall into certain risk categories. And another university, Florida A&M University, has scheduled shower times so that students are not all going to the shower at the same time in the mornings. And so students, I believe, schedule their own shower time or shower window where they can use the facility. The University of Colorado at Boulder allows students to live in cohort groups with students that they attend classes with. And that's on the previous slide, I was talking about the intermingling or allowing students to maintain in groups, and that's one way that it can be done. So I think that University of Colorado Boulder example is a good example of ways that you can do it if you know that there's a group of students that are going to have several classes or courses together, allowing them to engage each other and live in the same pods so that it minimizes their interactions with other students. So now we'll talk about the at-risk populations. So you should consider whether at-risk populations should be placed in higher risk housing, and those at-risk populations may include students with asthma, students with diabetes, students with immunosuppressants, cancer, heart disease, HIV, or morbid obesity. From my understanding from working with clients that most of you have already thought through this scenario at place. This is just there for anyone that hasn't done that at this time. But if you haven't done this at this time, it's our suggestion that you should think about ways that you can protect these at-risk populations. From what we know about this disease, these specific at-risk categories seem to be struggling a little more with the virus. So in order to offer these individuals an education environment as safely as possible. These are things that we would suggest that you at least consider and see if there's ways that you can develop housing for these populations. So let's go to our first poll question. So Allison emails her professor saying she feels sick and cannot attend class. The question is simply, should the professor require a positive COVID-19 test result or a doctor's note in order to excuse her class attendance? Yes, no, or I don't know. All right, it looks like 100% of the participants have selected no, and that's absolutely right. So do not require a positive COVID-19 test or provide or request that they provide a note to validate an illness or qualify for sick leave or to return to work. You should develop policies to allow students and employees to isolate themselves and that they are sick without facing repercussions. What we don't want right now in this environment is people feeling like they're going to be punished for staying home or following local rules or ordinances involving COVID-19. We want to encourage those students and employees to stay home, to slow the spread of the disease, and to keep other members of the population safe. So you should offer options for faculty and staff at higher risk for severe illness that limit their exposure to the risk. You should offer options for students at higher risk for severe illness to limit their exposure for the risk. But you also want to create consistent policies that protect all of these individuals and protect individuals that are feeling sick to where they have confidence that they won't face any type of retribution or if they are unable to because they may not have enough sick leave in their balance to stay home. And so when we're thinking about those things, what you should do is you should examine your current sick leave and excuse absence policies, revise and implement the policies to allow students, faculty, and staff to stay home, to care for loved ones with COVID-19, to work or attend class virtually. So is it possible that we can do the work, especially if this is an employee and this is a leave situation, is it possible that there are tasks that this employee can be doing in the virtual environment? Tend to dependence in the case of school day or day closures. So develop policies that allow for returning to work and school after COVID-19. And a good example of this is at the University of Wisconsin. They established a policy that would continue pay and leave usage for UW system employees during the COVID-19 pandemic. And they want to do this to minimize the spread of the virus. Many employees have been directed not to report to the workplace to facilitate social distancing. And so many employees are under the way things are set up at UW, many employees were able to perform their assigned duties remotely where possible and appropriate. The core operations needed to continue in that situation, and so some employees were required to perform their assigned duties on site. Those that were able to perform those duties remotely, they were just able to move to the virtual environment. So as we grapple with COVID-19, we want to stay aware of state and local policies relating to gatherings. As we all know, every city is different, every county is different, every state is different, and so you want to just be aware and stay on top of what is going on in your specific area, because the ordinances do vary, from city to city, county to county, state to state. And so I would encourage that you have a staff person that is assigned to be on top of this, and I'm sure that you already have that on all of your campuses, but we want to continually monitor ordinances that address the size of events, where events can be held, and if events can be held at all. I know here locally, Even in Kansas, there's been some changes recently where ordinances have been implemented by cities where colleges are located that are trying to limit the number of gatherings that occur. And so it's just it's all developing as we know. And so you just want to make sure that you are constantly in communication with your city, with your county, with your health department so that you can keep students updated on what the limitations are on these gatherings and reinforce those types of things, those policies for the on behalf of your local community. So you want to consider campus-specific policies for violations of these laws. I know within the last couple of weeks there have been many higher educational institutions that have developed new policies and in order to limit the spread of the virus on campuses, specifically to try to limit, the super spreader parties that we're hearing about in the news. So, and as I stated earlier, this can be done by to stay on top of the regulations. It's best done to have a specific COVID-19 point of contact at your institution that can be aware of all relevant regulations and policies, and also to be a contact point for students, faculty, and staff. So, best practices for COVID-19 communication systems. We want to put in place a system for self-reporting of COVID-19 symptoms. We want to also have the system in place where people can, whether it's a student or a staff member, can report a positive test, or also allow them to report exposure to someone with COVID-19, and also to notify of closures and restrictions that are in place. You must stay in compliance with federal, state privacy, and confidentiality laws, of course. So the main concerns are whether or not communication of any of these things are going to be a FERPA violation, or whether those would be a violation of HIPAA. So I just want to first just talk about a few myths when it comes to HIPAA and FERPA. Well, specifically HIPAA myths within higher education. So myth one, HIPAA applies to student health records. The fact is, student health records fall under FERPA. So while some employee health records would fall under HIPAA, for the most part, student health records are going to be an issue that would be, communicating it would be a violation of FERPA. Myth number two, HIPAA prevents universities from requesting medical records. The fact is, institutions may request medical records for legitimate business reasons. Myth number three, students and employees can sue the university if their personal health information is released. The fact is, individuals cannot sue directly under HIPAA. So, HIPAA does not apply to health records maintained by educational institutions if those health records meet the definition of education records or treatment records under FERPA. Because student health records generally fall within these FERPA definitions, they are exempted from HIPAA. So although releasing potentially identifying information may be exempt under HIPAA, your university would likely be violating FERPA for treatment of non-students at the Student Health Center does not fall under HIPAA. However, for employees, while HIPAA may protect the privacy of medical records an employee submits to the institution's health plan for purposes of making an insurance claim, HIPAA would not apply to copies of the same records the employee shared with his or her employer for the purpose of validating sick days. HIPAA does not regulate the ability of institutions to request medical information from their employees and students for legitimate business reasons. Also, HIPAA does not protect the student from having to provide medical documentation to substantiate absences. So HIPAA does not create a private cause of action. Instead, HIPAA is generally enforced through regulatory action from the Department of Health and Human Services and the Department of Justice. So what is FERPA? FERPA is the Family Educational Rights and Privacy Act. FERPA protects students' educational contact and personally identifiable information, applies to any school or department that receives funds from the U.S. Department of Education It's enforced by the Federal Student Aid Department. So the applicability of FERPA will be unique to each institution, and it depends on whether any department within the university receives funds from the Department of Education. So FERPA and COVID-19 considerations. Generally, universities are allowed to identify that a student or employee has tested positive for COVID-19. Personally identifiable information must be kept to a minimum, however. Student directory information cannot be released in connection with health information. So you must obtain consent before releasing any student directory information. Under no circumstances can a student information be released to the media. Protected information can only be released to appropriate parties. In December 2019, the U.S. Department of Health and Human Services, together with the Department of Education, released a joint guidance on the applicability of FERPA and HIPAA to student health records. And the protection of health information isn't set aside during an emergency. So as we look at this, the joint guidance address the possible exception when responding to an outbreak of infectious disease. However, universities should still seek to obtain written consent from students before releasing any potentially identifiable information. So with the health and safety exception, protected student health information may be disclosed without student and patient authorization if any of the three apply. So the disclosure relates to the treatment of the patient or additional individual. Number two, the disclosure to family or friend or other person that is involved with the patient's care. Or three, the disclosure prevents serious or imminent threat to the patient, another individual, or the public. So here, and as I've spoke with clients the last few months, when it comes to making a disclosure of a student with their information, the most likely scenario that it would be used in the context of COVID would be number three, where there is a health and safety emergency. So the health and safety emergency could allow the institution to disclose the necessary identifiable and health information that pertains to the student's public health agencies. However, this would only be allowed if it would be determined to prevent a serious or imminent threat to the public. Institutions should always still seek to obtain written consent from the patient or students or parents if necessary. Because if you had the consent of the individuals, then you wouldn't have to make an argument that you release this information because of the imminent threat to the patient or other individual of the public. If you have their consent, then you can disclose the information. If not, what you're going to have to show that you did this in order to prevent a serious or imminent threat. So if a university chooses to disclose unauthorized information that is covered by FERPA, the institution must be able to explain the basis for their decision and for such a disclosure and how it relates to the health and safety exception. So that's what I was referring to in the previous slide. It's always easier if you have consent, but if not, what you're going to have to do if someone ever files a complaint because you alleging that you have violated FERPA, is you're going to have to prove that the disclosure was necessary for that particular reason. So best practices to consider. Universities should strongly consider the need to publicly disclose confirmed cases of COVID at their institutions. While initial disclosure will likely not violate FERPA or HIPAA, disclosure might create additional questions that the answers of which could cause violations. So institutions should consider whether or not the disclosure would aid the campus community or if the disclosure would cause undue panic and questions. So to do this, you want to You must try to avoid disclosures that are unnecessary or overly broad. Personally identifiable information pertaining to a student should be excluded or minimized as much as possible. Do you need to say Demetrius Peterson, or can we say a student living in Husch Blackwell Hall? Think really closely if it's really necessary or truly necessary, depending on the facts of the specific situation, to identify the specific individual. Can we just say what class or which section the person is? Can we just say which dining hall? Can they say a member of a specific team or group? Is it really necessary that we communicate the name of the individual? And document, and if you decide that it's necessary, you want to document your rationale for any and all disclosures. That would be an exception to FERPA. We want to save that. We want to have written down why we went down the path we went down, what the specific facts were, and why we felt it was necessary to protect the campus to make that disclosure of identifiable information. So the last couple of weeks, we've seen several examples of student discipline policies being updated, specifically in regards to student health and safety or campus safety regarding COVID-19. The discipline typically ranges from warnings or writing a paper, as some institutions are doing, to more severe things, including suspensions or long-term suspensions. I've seen situations in the news where students were expelled for blatantly disregarding. And so that's up to each individual institution and the university's health and safety protocols. And you want to develop protocols that ensure that your institution is following the policies set forth and instituting discipline in a timely manner. So next, we're going to transition to Teresa, and she's going to talk a little bit about testing and contact tracing.
Thanks, Demetrius. As we know, contact tracing is used to identify cases and notify those who may have encountered positive COVID-19 cases. College campuses are unique for this because students live in close quarters and work and study in close contact with other campus stakeholders. So, under the EEOC guidelines, employers may mandate a COVID-19 negative test result before an employee comes back to work after being infected with COVID-19. However, antibody tests are currently prohibited to be required by employees to undergo prior to re-entering the workforce. The latest guidance from the EEOC was on June 17th, 2020, which stated that antibody tests constitute medical exams and are therefore not permitted under the ADA. However, a change in the EEOC's position may occur if and when new scientific information develops relating to the reliability of antibody tests. We have seen several universities develop COVID-19 tracking apps, and a great example we found was from the University of Alabama. The University of Alabama requires students to complete an online course on the basics of safety and hygiene regarding COVID-19. The use of a symptom tracker app is highly encouraged, and in this app, students and employees use the app daily to track their symptoms and report any symptoms with COVID-19. The app is strongly encouraged but is not required. If a person using the app records testing positive for COVID-19, the app then notifies the phones logged as being within close contact of the individual who disclosed a positive COVID-19 test. However, like Demetrius talked about earlier, the app does not go into detail specifically about the student. It just says that you have come into contact with someone who tested positive for COVID-19. There are similar app designs that are also in production by Microsoft, and Google and Apple have a joint effort to create apps like this as well. With these contact tracing apps, there are some potential privacy concerns. First, some people could be refused from returning to work on campus merely because their app shows that they have been in close contact with someone who reported having COVID, even if the result was a false positive. And we have seen from our clients that there has been disparate impact on individuals living in densely populated neighborhoods and popular student apartment buildings, as they might have experienced a higher number of false positives due to their close proximities to others. Additionally, there's a need for ensuring participation in this type of surveillance through the app is entirely voluntary, like the University of Alabama example. Finally, we encourage higher education institutions to make sure to have a plan regarding who will have access to the health information inputted into the app, when tracking contact will stop, and how the stored information will be deleted. Next, we're going to transition to talking about mental health on campus and resources to have available to your students, staff, and other campus stakeholders. This has been an important topic and has only become more important as a result of COVID-19. As we know, it's likely students, faculty, and staff are experiencing increased levels of stress, including financial fear and worry, changes in sleep or eating patterns, worsening health, and a potential increased use of tobacco, drugs, and alcohol. Additionally, students have reported that life is more difficult now due to the online and virtual world, with social media, classes being online, the news cycle, social isolation, and quarantining, and the social distancing required to limit exposure to the virus. Now, specifically relating to socialization, we have seen that mental health experts are encouraging university officials to not chastise students for socializing, as they have found it is harmful, ineffective, and does not consider the student's developmental needs. However, higher education institutions have a duty and a standard of care, like Demetrius talked about earlier, to help ensure that the virus does not unnecessarily spread. So what we recommend to our clients is to provide clear rules and policies regarding socialization and social distancing protocols, and continually communicate those expectations with students. Furthermore, there are individuals on your campus who are likely at a higher risk for mental health concerns, including those that are older and have underlying conditions that may be more worried about contracting the virus. Your young adult students, particularly your freshmen, who this is their first time away from home, and it's a very different freshman year experience than was anticipated. And your students and faculty and staff that have existing mental health or substance abuse conditions. And one thing we wanted to flag for our clients is if your institution provides an employee assistance program, consider an increase in marketing about your program to bring additional awareness and help to your employees. Now, for students, we have seen a rise in students wanting to find a therapist to talk to, either through online, like Zoom, using an app on their phone, or going in person to the university's Student Health Center to use therapists in person. We encourage you to work with your services on student outreach regarding mental health services available to your students, and we also encourage your student staff to help students with self-care strategies like staying active and setting routines to help with students' mental and physical health. Additionally, we have clients ask, what can their institution do specifically to help? Especially now, it is critical to promote health and safety on campus, and strong mental health services help with that. we encourage our institutions to enhance their mental health services that are provided and continue to provide education materials and market your available services to your students and help reduce the stigma surrounding mental health and using the services provided by the university. And we encourage it to be a holistic approach and have a strategic behavioral health plan campus-wide to make sure all stakeholders are in communication with each other, know what the university provides, and have a cohesive plan. Additionally, some more best practices, including staying up to date on current mental health prevention measures and making sure that you are in contact with your university police and maintaining your current mental health resources and providing training for your employees and students. We also encourage schools to develop a student suicide prevention protocol, a student suicide attempt protocol, and a protocol for if a student has died by suicide. We have seen a rise in telemental health as a direct result of the COVID-19 pandemic, and this provides a way for mental health providers to provide their services in a safer way, and it helps to have a plan in place to distinguish between those who want or need to use telemental health services and those who may want or need to see someone in person. And what we have seen from our clients is that students who haven't previously used mental health services provided by the university are now trying to use them as the pandemic has helped develop a need for them to have mental health support. And we've seen on some campuses where students that had previously used the student health services available on campus are needing extra support, contact, and resources because of the pandemic. And as we've touched on throughout this presentation, it's important to make sure that what you're doing complies with relevant privacy and confidentiality laws. Elemental health has been helpful in that it has provided a path for mental health providers to continue providing services to students during the pandemic. And in many colleges, there has been a rapid and successful migration of counseling and mental health services to tele-mental health. But with this, confidentiality must be considered. Your university needs to be prudent in certifying that all telehealth sessions and information is confidential and that everything is still in compliance with HIPAA and FERPA. Additionally, we encourage you to partner with your IT department to make sure that the data is safely secured and to have a plan in case there is a data breach. So with that, I'm going to turn it back over to Demetrius to talk about the ADA specifically related to COVID-19.
Thanks, Teresa. So the importance of the Americans with Disabilities Act in relation to COVID is the ADA regulates employers' disability-related inquiries and medical examinations for all applicants and employees, including those who do not have ADA disabilities. The ADA prohibits covered employers from excluding individuals with disabilities from the workplace for health or safety reasons unless they pose a direct threat, meaning a significant risk of substantial harm, even with a reasonable accommodation. So the ADA requires reasonable accommodations for individuals with disabilities, absent undue hardship even during a pandemic. So last March, the EEOC updated its pandemic preparedness guidance by acknowledging that the COVID-19 pandemic met the ADA's direct threat standard, allowing employers to impose more extensive medical inquiries to employees. A direct threat finding means that having an employee at work with COVID or COVID-19 symptoms would pose a significant risk of substantial harm to others in your workplace. This permits employers to put in place certain medical testing considerations and measures the ADA would not typically permit, such as taking employee temperatures, and that's something that I think is being done that's pretty widespread lately, and other measures, other similar measures that have been adopted since the pandemic's onset. And so when we talk about Section 504, I'm referring to Section 504 in the ADA, I'm referring to Section 504 of the Rehabilitation Act and the Americans with Disability Act. So the general purpose of both laws is to eliminate discrimination and exclusion from services, programs, and activities with regard to educational institutions. So Section 504 is going to apply to universities and colleges that receive federal financial assistance from the DOE. So it would only apply, once again, if they have received funds. The ADA, Title I of the ADA is going to apply to employees. Title II is going to apply if they're a public university or college, and that's going to be administered by the Department of Education Office of Civil Rights. And then Title III is going to apply to private universities and colleges. So let's start out with the definition of disability. What's a disability? A disability is a physical or mental impairment that substantially limits one or more major life activities. You must have a record of having an impairment that is substantially limiting to a major life activity, and be regarded as having an impairment that is substantially limiting to a major life activity. So the EOC enforces workplace anti-discrimination laws, including the Americans with Disability Act and the Rehabilitation Act, which include the requirement for reasonable accommodations. Title VII of the Civil Rights Act, which prohibits discrimination based on race, color, national origin, religion, sex, and pregnancy. And the Age Discrimination and Employment Act, which prohibits discrimination based on age 40 or older, and the genetic information associated with this. So there are other federal laws as well as other state laws that may provide employees with additional protections, including state civil rights statutes. And so just be aware of that. But when we're talking now, we're going to talk about 504 and the ADA. So what are examples of major life activities? It's walking, seeing, hearing, standing, speaking. This list isn't exhaustive, but it can also include the ability to toilet, the ability to sit and stand. Those would all be major life activities. And notice that in the definition of disability, it would only be substantially limits. So if it moderately or mildly limits, that would not meet the definition of disability under Section 504 or the ADA. So let's do some question and answers regarding COVID-19 and the ADA. So can an employer ask an employee if they have symptoms? Yes. This must remain confidential and comply with the ADA, but you can ask an employee if they have symptoms. Can an employee measure an employee's temperature before work? Yes, as we discussed a couple slides ago, that's perfectly compliant under the ADA. Can an employer require a doctor's note certifying fitness for returning to work? Yes, that is okay. Can an employer mandate a COVID-19 test before permitting employees inside the workplace? Yes. How about antibody tests? As Teresa talked about in her session, right now that's no. So the ADA and Section 504 continue to apply during the time of this pandemic, but they do not interfere with or prevent employers from following the guidelines or suggestions made by the CDC or state or local public health authorities about steps employers should take regarding COVID-19. So symptoms checks, temperature checks. Employers should remember that guidance from public health authorities is likely to change as the COVID-19 pandemic evolves. So as I stated earlier on in the presentation, it's important to stay abreast of any changes that are being made locally. So city ordinances, county ordinances, state ordinances, and also suggestions by the CDC. Therefore, employers, you should continue to follow the most current information. Make sure that you're staying updated on the most current information that's being released. So as we talk about reasonable accommodations, under the ADA, an employer must make reasonable accommodations for an employee with a disability. This is absent undue hardship. This is an interactive process, and there is no one-size-fits-all approach to what is reasonable. So some low-cost solutions that we may see right now are creating barriers, creating one-way aisles, a request for an employee to put up plexiglass at their workstation if they're in a cubicle, or maybe if they're at a ticket window or something like that. So employers should also maintain flexibility. Think if you have someone that has a disability or needs accommodations, is it possible that we can restructure their position? Is it possible that we can work with scheduling it and have them not there in the in the highest the busiest part of the day? Is it possible that we can shift assignments in order to accommodate the employee? Remember, you're not required to permit an individual to participate in or benefit from facilities, services, or programs when that individual would pose a direct threat to the health or safety of others, as we discussed under the direct threat. But we should, go through the interactive process when there's a legitimate disability under the ADA, and absent and undue hardship, we should accommodate the employees. So in 2009, the EEOC actually released a technical assistance publication, and it's titled "The Pandemic Preparedness in the Workplace and the Americans with Disability Act." And it addressed several questions relating to how employers can address issues arising during a pandemic. And if you can remember, in 2009, the pandemic that we were experiencing was H1N1, also known as the swine flu. And so in this publication, the EEOC concluded that both the ADA and Title VII prohibited an employee from compelling its employees to be vaccinated, regardless of their medical condition, regardless of their religious beliefs, and it even said during a pandemic. So that's the most recent guidance that we've received related to vaccines. I assume here, as we get further along and vaccines do become available, I assume that they're going to address this again, and I assume either way, these are things that are going to be we're going to see these issues litigated. So right now, vaccine mandates can stem from one of two sources: one, state statute or state regulation, or two, a private employer's workplace rules, and different legal frameworks are going to apply to each. So return to work. An employer may require an employee to wear PPE or maintain infection control. I've already received this question in different ways from different clients. Some it's face shield, some it's face covering. People not wanting to wear face coverings and requesting, based on their disability, if we would allow, or if the university would allow the face shield. So those are things that I'm sure that you all are going through on your campuses right now. Where an employee with a disability needs accommodation, so face mask versus face shield, gowns for those with wheelchairs. Employers should provide accommodations, as I stated, unless there's another reasonable alternative, absent and undue hardship. Poll question: an employee has a disability that puts her at high risk for severe illness if she contracts COVID-19. She requests a reasonable accommodation. Does the ADA apply in this situation? Yes, no, or I don't know. Give you one moment. Looks like most of the answers are in. So let's go ahead. Move forward now. So if the employee has a disability that puts her at high risk for severe illness, if she contracts COVID-19, and she requests a reasonable accommodation, if she has a disability, then yes, that should be something that the institution should look at. I've seen recently a lot of requests coming from an employee whose family member has would be in the high risk population, and currently right now that is not something that we should accommodate or that we have to accommodate. Obviously, that's an employer's choice, but that's not something that would be required. You're not at this time. You're not required to make accommodations for an employee's family member. But as we stated earlier on in the presentation, we should be supportive of employees if a family member has become ill with COVID-19, and address that via our workplace policies or our leave policies. So we've got a few minutes, and so I wanted to move forward with some service and support animal slides. We originally intended to be really heavy in the service and support animals before we realized that it would be tough to do student health on campus without talking about COVID. And so Teresa is going to talk to you now about service and support animals.
Thanks, Demetrius. So the Fair Housing Act requires a covered entity to make reasonable accommodations to afford people with disabilities an equal opportunity to use and enjoy a dwelling. And the Department of Housing and Development and the Department of Justice consider dormitories to be dwellings. And the Fair Housing Act makes it unlawful for a housing provider to refuse to make a reasonable accommodation, as someone with a disability may need to have an equal opportunity to enjoy and use a dwelling through a reasonable accommodation. And one common request housing providers receive for a reasonable accommodation is often related to the provider's no pet or no animal policy. And we see a request for an accommodation so that individuals with disabilities can use their assistance animals in their housing, including in public and common use areas like are seen in dormitories. So not only does the Fair Housing Act apply, but higher ed institutions should also look towards state law. Many states provide the right to use a dog or a miniature horse in a place of public accommodation on the same basis as the ADA. Additionally, these statutes may include penalties for individuals who falsely claim to be using a service animal. Now, under the ADA, there are requirements for a service animal. First, a service animal must be in control, either with devices or with words. And there are some reasons that your institution could exclude a service animal if the service animal is not housebroken or if the institution deems the animal to be out of control. Also important to note is that the housing provider may not charge a fee or deposit for a service animal. Now, what can your institution ask about a service animal? There are only two questions you can ask. First, is the animal required because of a disability? And what work or task has the animal been trained to perform? No other inquiries about an individual's disability or the service animal are permitted. You cannot require proof of certification or medical documentation as a condition for entry for the individual or for the service animal. Now, sometimes we get questions, what is the difference between a service animal and a support animal? So a service animal is any dog that is individually trained to do work or perform tasks for the benefit of a person with a disability, including physical, sensory, psychiatric, intellectual, or other mental disabilities. Other species of animals, whether wild or domestic, trained or untrained, are not deemed service animals under the ADA. Additionally, the work or task performed by a service animal must be directly related to the individual's disability. as we saw in the previous slide, what can you ask? The second question is, what task does your service animal help you with? This is where that comes into play. Now, support animals are different. A support animal can be a dog, but it could also be a more unique animal, such as a cat, a bird, a lizard, but it has to be something commonly kept in a home. And if it's one of these less common animals but still kept in a home, like a bird or a lizard, you can ask for extra documentation to ensure that it does indeed provide emotional support, comfort, or well-being. Additionally, your institution is not required to allow any non-domesticated animal, such as a reptile, a barnyard animal, a monkey, or a kangaroo, which we have seen as a request, as an acceptable support animal. So that's really the big difference. A service animal can only be a dog. A support animal can be a dog or another animal commonly kept in the home, and they serve different functions. So with that, I'll turn it back over to Demetrius to wrap up our presentation.
Thank you, Teresa. Before we end out, I did receive a number of questions today, and Teresa and I will respond via email to all of your questions. There's one I wanted to answer, and we may be able to get to a couple before our 3 minutes is up. But one question I received is it a potential ADA violation if you place at-risk population students together in housing? Because such an action would identify those students as having an at-risk medical condition. And yes, that could be a concern. It could also be a concern if you were just automatically sending a student that you were aware had fit into an at-risk population, to automatically send them, away from, the traditional housing, hierarchy or traditional housing approach, wherever you would send student normally, if it was by class or by gender. So that's something that you should think about. But also, one way to do it is just to have a conversation, have your ADA coordinator or your housing director contact those students and engage in an interactive conversation with them about the availability of, housing, saying that, you want to put them in this other housing, to help or provide it as an option to help keep them safe during this time, and come at it, from that angle. We have this special housing available for you to protect you during this time. This is not, permanent, but we want to have a successful and safe school year. And so I think if you approach it with that, if you have it available, I think many students would take advantage of it. But if you were just sending, students with a disability to one particular housing unit that's not, within the normal scheme that you would provide, that possibly could be an issue. And so thank you all for joining us today. We hope that the information was helpful to you and your organization. As a reminder, this program has been approved for legal education hours. To report your hours, you click on the CEU icon at the bottom of the screen. A certificate of attendance, including course numbers, will be emailed to you tomorrow, along with the recording of the webcast for watching and sharing. Be sure to complete our short survey. We use your feedback to plan future programming that are applicable to your business needs. This concludes our webinar. Thank you. And as I said, we will respond to your questions that we didn't get a chance to answer via email within the next business day. So thank you.